Hi, hello, welcome back to my channel. About a month or so ago, I had a question box on my Instagram and here on YouTube, and I asked for you to send in questions about fibroid surgery, anything that you want to know, anything, and I got a few responses, and so I'm going to go ahead and answer those questions the best I can. Just a quick disclaimer, a quick fine print. Since I'm talking about medical things, I'm not a doctor, I'm not a nurse. I do have the experience of having fibroid surgery. Quick backstory, I had fibroid surgery almost 2 years ago now, 3 years maybe. It was 2021. I had 8 fibroids removed. The biggest one was the size of a golf ball, 3 centimeters, and the rest were tiny little ones, almost like popped popcorn, a little bit more smaller than that. You want to get down? I fell pregnant 9 months later with baby. So the first question I got, I have my notes right here. My first question is, what causes uterine fibroids? What causes uterine fibroids? Per my research and talking with my doctor and everything, it's unknown what truly causes fibroids. Some studies show it's a lack of vitamin D, it can be diet, it can be high estrogen levels, and even childlessness. I guess some studies do show there is a trend that mostly older women who are childless tend to have a fibroid. Now, like I said, the studies are not, concrete. They're not set in stone, of course. There can be several things contributing to why fibroids grow. They are benign tumors. They're not cancerous. That's what that means. And so, are you okay? And depending on the circumstance, they may need to be removed to allow for fertility. Like in my case, I had to get the surgery done to help with my fertility. So high estrogen levels, lack of vitamin D, childlessness. There's countless studies that talks about this, but it's really hard to pinpoint what exactly causes uterine fibroids. The second question I have is, how big should the fibroids be before doctors suggest a surgery? This is a really good question. So depending on how big the fibroids are, they can impact fertility. Mine weren't super big, super huge or anything. I know I've seen cases of that where they're like huge. You may want to consult with your doctor. He or she will let you know if it's worth getting it removed, depending on how big it is. But I do know just from experience, the bigger they are, you may want to get them removed just for safety, relief of symptoms. I know it can impact the menstrual cycle, fertility. So if they are pretty big, I would say, logically speaking, you want to get them removed. Okay. My third question that I have, are patients likely to lose their memory after the anesthesia injection? How do they gain their memory back? So during the surgery, you will have, what's it called? They put you to sleep. The anesthesia, of course. I didn't lose my memory or anything like this. I didn't have this issue. When you go in the day of your surgery, they're gonna have you sign a bunch of papers like HIPAA and all that paperwork, because you're taking the risk of having this surgery done. And I'm pretty sure that's probably on there as like a risk. You may lose your memory, but I did receive an injection before my anesthesia shot the day of my surgery, and I kind of like just went out. I went straight to sleep. That shot was like a what's the word, sedation. Like I was sedated, so like I just closed my eyes and then that was it. I was like gone before they wheeled me over to the surgery room where I got the anesthesia done. I didn't have memory loss. So I don't know how to help in that question, but just talk to your doctor or just talk to the anesthesia, and you can just go from there. So number 4, this is a really important question. How's the healing process like? This is a really important question. So for the first 2 weeks, I was very sore, very tense. It was soreness, very sore, a little bit of throbbing. It was hard to walk fast. I had to walk really slow. It was hard to bend over, use the stairs, and even drive my car. Yeah, you recommended not to drive for at least a week or 2 weeks, and use the staircase for at least 2 weeks. I healed completely after 6 weeks, and I had a countdown going on actually. Each week of the day of the surgery, I had a countdown, like week 1, week 2, I was waiting to heal, and I healed, no infections, no anything. 6 weeks later, my metal stitches came off 2 weeks later, which loosened up the soreness a little bit. And then I took pain relievers, prescriptions, gabapentin. I didn't like gabapentin. I think it's more for people with seizures or something, but surgeons will use it to knock out the pain for surgery, patients with surgery. I guess surgeons will also use it to eliminate the pain in the surgery process. But gabapentin, it makes me feel dizzy and like woozy, headache, woozy, whatever. So what I did, I just started taking my Tylenol two times a day, just regular over-the-counter Tylenol and acetaminophen, if I can pronounce that. It's hard to use the restroom. There's like a lot of pressure when trying to go, and I had to use a high-seated toilet. That really helped a lot. We got it from Walmart. It was like $40. I got it from Walmart for like $40. I had to wear diapers the first 2 weeks. Overall, this surgery process is like getting a C-section, but instead of a baby coming out, fibroids are coming out, if that makes sense. Okay, number 5 is pretty self-explanatory. I kind of already answered it, I'm sure. But number 5 is, did you go through a lot of pain after surgery? Yes, I did. Yes, I wrote it's very sore, intense pain. It's very sore. Like I said, I healed down around week 6. It was like completely gone. It takes 6 weeks to heal, and I don't know. It went by slow at first, and I started picking up speed. So a little over a month, my life was back. Number 6 is a really good question. It's, why do Black women get fibroids mostly? My only guess, based on research and talking with my doctor and everything, is it could be a lack of vitamin D due to melanin. It could be hereditary and diet. The vitamin D thing due to melanin is that Black skin, of course, have melanin, higher levels of melanin. And so because of that, I think it causes the sun to absorb, but yet then it also doesn't allow for the skin to get enough vitamin D. It's kind of like a sun blocker. I guess too much melanin can also act as a sun blocker, if that makes sense. So it kind of reflects away absorbing a lot of vitamin D from the sun naturally. Those with lower amounts of melanin, European ancestry, whatever, may have higher levels of vitamin D, but lack of more melanin, if that makes sense. I guess it sounds kind of weird, but that could happen. It's just like a natural thing, I guess. And so there's just less vitamin D. So that could be a study that they're probably still researching. Yeah. Hereditary, genetics, and then diet. I know different cultures have different diets. So, okay, this is a simple question. How long was the surgery process? It was about 2 hours total, and it was a 2-night stay at the hospital. You would most likely have to stay 2 nights at the hospital. They recommend it in case something does happen. The doctor can be able to be there for you. Last but not least, we're almost done, baby. We're almost done. Did the fibroids grow back? Now, I guess this is like a question for me particularly. No, they did not grow back. I had it checked during my ultrasound when I was pregnant. I kept asking my doctor to check the ultrasound and everything, and nothing was there. As of right now, today, within this last year of giving birth, I wouldn't know because I haven't had an ultrasound since my 3rd trimester, which was a year ago. when I had my fibroids, I didn't have any symptoms. It didn't affect my cycles each month. I didn't have anything. I had no symptoms. And if you're needing fibroid surgery, don't worry. It is actually a very, very common thing. A majority of women have to have it done. It's very common. The pain is manageable. Thanks for sending in the questions, and I really hope this helps you on your journey of your fibroid surgery process. Until next time. Bye guys.